Let me start with ATFL first.
Yes, yes.
So we'll be going with the step-by-step approach for the ATFL. Remember, it is the ligament that is most commonly affected. Two ligaments important. One is ATFL and one is the AITFL. So most important is the ATFL because that is the ligament that is most commonly affected. So let's start our scanning from this bone. Can you see this? This is the fibula. So if you put the probe just above the fibula, we'll be able to see this structure. Just 1 second, let me unfreeze. So over the fibula, there is a specific look which is known as the shark fin appearance. So we can see the shark fin appearance of the fibula. Now, what are the important structures just posterior to this? So immediately posterior to this, we have two muscles. This is the one by one I am showing. Just 1 second, settings, and then scribble. Okay, so I'm just taking it over one muscle. So this one is the peroneus longus, and this muscle is the peroneus brevis. So as I come anteriorly, so keeping the peroneus longus and brevis towards the right side, or you can say posterior side, let me increase the gain slightly because otherwise. So here we can see the peroneus longus and brevis remaining at the posterior side, and the shark fin appearance you can see. Just going to the anterior side, we can see another bone. So what is this bone? This bone is obviously the fibula. But what is this bone? Can anyone tell at this point what could be the bone here?
Calcaneus.
Yes?
Calcaneus, sir.
No,
Tibia.
it's calcaneus. See,
Talus.
what
Talus.
I'm handling.
Tibia.
Calcaneus is here.
Tibia.
Tibia. Definitely, the bone here is tibia. So first we need to follow the gap between the tibia and fibula, and we have to find out where the tibia ends. See, at this point fibula is still there, but tibia is ending. As we go further, then we'll be able to see another structure which is actually a pyramid shaped structure with cartilage over it. So what is this bone? Under the tibia, what is this bone?
Talus.
Talus.
So two ligaments mainly remains at this point. One is the anterior inferior tibiotalar ligament. Remember, it can be injured, but it is a tough ligament, and when it is injured, it is mostly associated with some bony deformity as well. But we'll be seeing both the ligaments because for understanding it will be easier. So let me go back to the this point where we are actually the tibia is ending and fibula. Now I am doing a little bit trick here. I am keeping the fibular point intact. Okay, I am fanning it slightly over. Okay, so that we start seeing the which bone? Tibia again. So here for this volunteer, the size is very small because the leg is also very small. So in between these two bones at the lower end, we can see a ligament. Remember, it is not a horizontal ligament. You can see how we have put the probe. We have put it slightly obliquely, and in between the tibia and in between the fibula, we see this ligament. Okay. Let's take the pen and draw it for you. So this is the upper margin of the ligament. Here lies the lower margin of the ligament. So you can say it's a large ligament, and this ligament is a very strong ligament. This is the AITFL. That means the anterior inferior tibiofibular ligament. So we have understood how to find out the anterior inferior tibiofibular ligament. Remember, the injury of this ligament is comparatively rare because it's a very strong ligament and it forms the part of the mortise. Now, again, I am going back the steps one by one. So follow this shark fin shape. So you can see the shark fin of the fibula. Here towards the posterior side, we can see the peroneus longus and brevis. Go to the anterior side and find out the mainly the peroneus tarsus and the flexor digitorum, and then we go down, 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 where it ends, okay? Where the tibia ends, and once the tibia ends, we start seeing one triangular muscle. This muscle is the talus. Now keep hold the lateral part on the fibula and rotate the medial part, sorry, not the medial part, anterior part, I should say it is correct, over the tibia again, and then the ligament in between these two bones, what we get is the anterior inferior tibiofibular ligament. But let's come to the most important ligament, that is the ATFL. Keep the probe there. Only again start fanning, keeping the posterior part over the fibula. Try to put the anterior part 90° from the previous angle. So what will happen? Again from here, from tibia, will be shift over to the talus, and as I go more towards 90°, so we start seeing another ligament. Okay, let me do one thing. We need to put a little bit more gel, because already with so much movement the gel is reduced. Again, I am holding it in the same fashion so that it is easier for you. From the previous ligament, let us move 90°. So first we will starting the again the triangle of the tibia, and next we will start seeing another ligament. And everyone see this ligament? To stretch it, let us put a little bit pressure, and here we can see the clear ligament between these two bones. Okay, so those who are not able to see it properly, I am trying to make it more clear. Actually, in ankle, we need to put a lot of gel for maintaining proper angulations. Otherwise, there are too many ups and downs. Okay, now you can see the ligament in between these two bones. Okay, let me stretch it a little more. So this is the ATFL. Okay, let me stop and let me draw it. A little bit anisotrophy towards the fibula is there, but here if you look at, the whole part of ligament is here. Okay, the whole part of ligament is here, which is connecting. Remember, there are no muscles in the talus. Sorry, and it came. There are no muscles in the talus, so only the ligaments are attached to the talus. Fortunately. Okay, so there are no muscles in the talus, but here we can see this ligament. So this ligament is the anterior talofibular ligament. So you can see the probe angulation. So it is slightly say horizontal or slightly below the horizontal, where you can see the best. Okay, so I am now in the live scanning, so you can see now you are able to appreciate it, everyone. Or I need to increase the gain slightly. Just 1 second. Okay, so now you are able to appreciate. Now with this
Yes,
gain,
sir.
it's seen beautifully. So
Yes.
now look for a little up and down. So in presence of any injury or there is nearby edema, because remember, when we get an ankle injury in most of the patients, okay, especially if it is an inversion injury, what happens? The most commonly this ligament is torn. Okay, even one of my ATFL is torn. Okay, so it is not partial, it is not a total tear, but it's a partial tear that injury I got long back. But remember, sometimes it can be painful for a very long duration. Okay, so what are the treatment options? First, in acute injuries, you have to go for the NSAIDs, rest, sometimes immobilization, but not entire immobilization is required. If it is responding well and good. If it is not responding, which becomes subacute, nowadays we go for the platelet-rich plasma injection within this ligament. So under this vision, you have to go in an out of plane approach, because in this ligament actually there are two bones in both the sides, so sometimes it becomes very difficult to approach just by the in plane. Okay, so ATFL, you have understood all the steps, or should I repeat one by one? I have repeated. So just the last part, first come from the fibula, go here, and first try to figure out the AITFL, then go and just rotate, just follow. I am just doing the other hand. I am just rotating it like this, okay? I am rotating it like this. But remember, you don't miss out the fibula. So one side you should be, keep it fixed at the fibula, then only you will get the other over the talus. So this will be the anterior talofibular ligament.